United States, we're often told that we have the best healthcare system in the world. That may be true for a select few, but for a large portion of Americans, the reality is much different. Many are left without access to basic health care. The U.S. spends twice as much on health care as the average industrialized nation. However, we do not systematically achieve the best quality care, nor is health coverage universal, as it is in every other major industrialized country. More than 46 million Americans lack health insurance, and by 2013, this number is expected to grow to 56 million. Here in Sarasota County, more than 18% of residents are uninsured. That amounts to more than 47,000 individuals, or more than 1 in 6 residents under 65. We focus on those under age 65 since virtually all senior Americans have some health coverage through Medicare. Cost is most often cited as the reason people are unable to obtain health insurance coverage. Among Sarasota County residents, nearly 3/4 of those without insurance reported that the cost for coverage was too expensive. For those with health insurance, the cost of coverage often creates a strain on household finances, even when the coverage doesn't actually cover that much.
I'm insured. Yeah, if I have a heart attack. Major medical under our policy covers any major catastrophe, heart attack, if you break a leg, something that costs a lot of money, that's where it picks up. I meant my premium and my deductible keeps going up, but my coverage doesn't get any better. It's astronomical.
The uninsured in Sarasota County are twice as likely to be employed part-time and more than 3 times as likely to be self-employed.
Pues sí, trabajo por mi cuenta, mi esposo también tiene su trabajo.
Does your employer offer health insurance?
No, they don't offer health insurance.
When I first had my oldest daughter, I had Medicaid. You know, you have to recertify, and each time I recertify, it's still like a waiting process because I'm self-employed. By me being self-employed, my income varies. So if you make too much money, you know what I'm saying, you won't be eligible for it.
Right. Whereas adults often rely on their employer for health insurance coverage, many children receive coverage through government programs. In Florida, more than 30% are covered by programs like KidCare and Medicaid.
I have a little girl, 5 years old.
Okay.
Yeah.
Is she insured?
With Medicaid.
Al ver que no tengo ahorita Medicaid para los niños, que es lo más importante, he investigado para tener un seguro privado, pero es muy costoso.
Without health insurance, are the children receiving?
No, they're not. No, I have to take them to the ER room, which bills me. I mean, like for one visit, it's like $1,000 for certain parts with medical treatment plus prescription, and I don't have that kind of money.
According to the Institute of Medicine, working-age Americans without health insurance are more likely to receive too little medical care and receive it too late. They're more likely to be sicker, and they have a 25% higher mortality rate.
It's horrible. I've went so long now without seeing a doctor. They found I have like temporal arthritis and may have cancer in my mouth. Yeah.
Because I couldn't afford to pay my doctor bills, and I'm having lots of problems with my leg.
In Sarasota County, the uninsured are about twice as likely to report their health status as fair or poor.
Ya la bebita ha tenido accidentes muy fuertes de que tengo que llevarla al hospital. Pues lo único que he hecho es curarlos en casa y espero que no hayan después resultados malos, porque cuando no se atienden es cuando hay después, con el tiempo, se resultan resultados.
When coverage options and ability to pay are limited, so are available healthcare services.
I normally wait until it's really bad. If it's not getting better, I'll go to the emergency room.
Bueno, cuando están enfermos y no están muy graves, yo los atiendo en mi casa. Cuando es grave, pues hay que ir al hospital. A mí me preocupa mucho eso, la verdad. Me alarma no tener clínica, seguro médico.
The responsibility for solving the health insurance crisis must be shared among hospitals and other healthcare providers, insurers, businesses and organizations, government, and you. Are you up for the challenge? Residents in Sarasota County are already working on solutions. Current progress related to the issue of the uninsured can be found on the web at www.getsarasotainsured.com. And to find out how you can get involved in improving the health of your community, visit the Community Health Improvement Partnership at www.chipforhealth.org. Together, we can make health happen.